Beauty really is nothing outside. I think the core of the beauty is health and balance. What I mean by balance is your soul, and you have to have something greater than what this earth or worldly things say is beautiful.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Jerome Cha, who has been practicing clinical dentistry in Oklahoma for over 30 years. And he is the only accredited cosmetic dentist in the state by the American Academy of Cosmetic Dentistry. He has been practicing for the last 10 years, focusing solely on dental facial volume compensation and TMD treatments. The Smile Makeover not only addresses TMG-related disorders, but also volumizes the aging face to reverse the signs of aging. Dr. Cha has lectured internationally, published several articles in dental cosmetic journals, and is a clinical educator at his Dental Teaching Institute, Dental QS. So Dr. Cha, welcome and glad to have you here.
Glad to be here. Thank you.
Yeah, so let's start from the very beginning, Dr. Cha. What first got you interested in the medical field?
My first study was psychology. And during my sophomore year in college, my psychology advisor told me that I should go to dental school. So that's how I ended up going to dental school, by chance, actually. But it fits my personality, and it's been a great career for me. I really enjoy it.
Okay. And so that led you to start your own practice, J Cha Cosmetic Dental. What led you to decide to start your own practice?
I think I started out as an associate dentist, but what I soon realized is that my passion is in doing comprehensive dentistry and also trying to problem solve all the things that were coming in. But as an associate dentist, usually you only get to do kind of a spillover dental work that the chief dentist doesn't want to do or too busy to handle. So I wanted to focus on slower paced dentistry where I can really try to solve problems for good for patients. And I think that was really the beginning of wanting to start out my own private practice.
Got it. Okay, and now that you have your own practice, I want to talk about some of the treatments that you provide. The first one was going to be the dental facial volume compensation smile makeover, which is a little bit of a mouthful there. But could
It
you explain
is.
what that is? I've never heard of that before, and I'm sure a lot of people have never heard of that. So what is involved in that?
I think it's commonly called dental facelift.
Hmm.
But basically, what I am doing is when patient has insufficiency in skeletal structure on bottom half, especially related to jaw joints, then I compensate to balance the skeletal structure out by designing the teeth in a particular dimensions. And what that does is not only it adds volume to aging face, which supports the soft tissue, because most often older populations seek plastic surgery just to address the soft tissue. But when you look at how our faces age, the primary problem is skeletal support. So by volumizing upper and lower arch, we can compensate that facial shrinkage and aged look, and it reduces the wrinkles and balances the facial structure and also makes the jaw joints work much more comfortably. So yeah, that's what I focus on nowadays.
Okay, so it's and It sounds like it's a little bit more geared towards people that are older. But is it always something that is kind of age onset, like they start to lose that, or are there other situations outside of age where this could be applicable?
Right, that's a great question. I recently saw 18-year-old young lady, and she had extraction to straighten her teeth. In the old days, and I don't think it's as common anymore, but still, when we see lots of crowding and we have to create space, we would remove like side teeth, the premolars, to create space and straighten the teeth. But the problem with that is we are essentially shrinking the volume or diameters of your upper arch. So she ended up having jaw pain or TMJ issues. And that is because her upper jaw was shrunken and lower jaw was locked in by the upper arch dimension. So lower jaw was pushed back. So her function wasn't comfortable and she was beginning to chip her front teeth because her lower jaw was wanting to come forward. So yeah, I mean, to answer your question, it I see all ranges of patients. When I didn't know about all these issues, then I would go ahead and repair or restore those chipped teeth and make them pretty. But after a while, they end up chipping them again. So you have to address the foundational skeletal issues first, and then do the cosmetic dentistry.
Mm. So how does the, I guess, more specifically, the treatment work? Like, it sounds like you're trying to kind of open up skeletally more so that there's more room in there. So how do you do that? Do you kind of like put something in there and then kind of like force
Yes,
it open, or how
yes.
do you do that?
So that's one way. There is orthopedic devices and braces, obviously, to expand the arches and what have you. But the way I like to do it is kind of a quicker way. I used to do it the old-fashioned way where I would expand the arches and what have you. And it takes usually 2 years or more. But if it's not really severe case, then what we can do is I put this micro joint balancing or orthotic that is glued on the lower teeth. And that is designed after looking at and studying your CT scan, the dimensions of your jaw. So I designed that to balance the length of your lower jaw and provide space for lower jaw to go wherever it wants to go. Because when we balance the skeletal structure, gradually the muscles will find balanced position by itself. So once that is determined, that gives me place to start designing the teeth. And I would say majority of the cases we have to balloon everything out, which is great because traditionally to place veneers, we would have to cut down your teeth. But since this is all additive, meaning we're just adding on to your existing teeth, we barely have to cut on the teeth, but design porcelain covers on the biting surface to make it taller, and then volumize the entire outer dimensions with porcelain.
Mm.
So
Okay.
it's a really cool, neat way to not only address aesthetic issues, but also find a balanced point for your muscles and jaw joints to work comfortably. And oftentimes I'll see a cervical neck that is curved sideways. And when we balance the lower jaw and we take a CT scan, then it straightens out for them. It's crazy.
That's interesting.
Yeah, it
Would have
is
never thought that fixing
absolutely
a jaw would do
amazing.
that.
Yeah.
Yeah. Okay. Now, when it comes to timelines, is this something that this procedure could be done in one sitting, or something that has to kind of be done multiple times over time?
So usually from start to end, it takes about 2 months,
Hmm.
or in a longer case, about 3 months. But usually we will finish within 2 months. And the way it goes is first we gather all the information like CT scan, study models, and I look at everything. And the first step is to design what I call trial smile. So from the study model, I'll design the teeth and balance the jaw out. And we will actually, without touching anything, when patient walks in for trial smile appointment, we just glue this on temporarily onto their existing teeth. We don't numb. There's no grinding of your natural teeth. We just glue that on, and then we test drive to make sure that aesthetic changes we see on the face is what we like. Patient can function comfortably, and usually within about a week or two, we bring them back and we start making the final ones.
Okay. So now within that 2 month period where you're doing this, is that after that 2 month period, are they already seeing the aesthetic changes, or is that just kind of the prep side, and then it takes a little bit more time for them to kind of get used to it, and then for the aesthetic changes to actually not take hold, but I guess for it to like, does it slowly kind of change over time after the 2 months?
The change is immediate. That's what's so wild is, we have one patient who has a really severe TMD, and her right jaw was really shorter than the left side. And when she smiles, her eye level is like this.
Mhm.
But once we balance that out, her eyes are level. So the change is immediate. So we volumize the bottom one half of the face. But if you could think about how the muscles have to occupy in a shorter distance versus longer, muscles contract way more on the shorter side. The longer side, muscles are relaxed. So as it contracts more, it pulls everything down. So when we level the upper skeletal skull by balancing the lower jaw, then all of a sudden your head tilt levels out and your eye becomes more level. So the changes you see are immediate. Yes, gradually over time, muscles will relax more and we see less wrinkles on the face without doing any Botox or any kind of aesthetic treatment. So
Mm.
yeah, the change is pretty darn quick,
Okay, that's pretty
which is
incredible.
really exciting.
Yeah.
Yeah.
Okay. Now you did mention TMJ, like this helps in some situations with TMJ. Let's start off with what is TMJ? I guess people who have it know what it is, but other people have no idea what it is. What is it, and basically how does it negatively affect you?
So the TMJ, it stands for temporomandibular joint, which is a location. We all have TMJs,
Mm.
okay, on both sides. TMD, temporal mandibular disorder, is proper term that describes all the facial pain and joint pain. But commonly, people say, I have TMJ, but that's kind of a misnomer. We all have TMJ joints. But usually the problem arises, so there's a joint, there's a disc in between the lower jaw and the skull. And sometimes that disc is pulled out of the joint and it's rubbing against the ligament. And then when the ligament wears out, it perforates, then now we have bone on bone contact. And that's where it becomes really painful. It starts out as clicking and then it progresses into pain and then severe pain. When we look at our TMJ joints, the blood circulation and all the nerve ending comes from the back side of the joints. And all the lubrication from vascularity comes from that vascular bed that is behind the joint, right behind the lower jaw joint. So when that space is compressed, then what's happening is you're reducing the circulation and recovery potential and also lubrication. So that's why when upper jaw is pulled back and lower jaw is locked in, that makes it very uncomfortable. And naturally, your body will say, I want to move forward. And the way that happens is if the teeth are locked in, then muscles have to contract and function in imbalanced or retracted way, which is really uncomfortable. Or people will start breaking or chipping the front teeth off to free the lower jaw to move. So actually, when that happens, patient symptoms actually improve.
Hmm.
So by designing the teeth, where we're increasing the height and allowing more space for the lower jaw to come forward naturally, then usually, if it's not really severe case, where it's not bone-on-bone contact, then it improves all that symptom and resolves it usually permanently.
Wow. Okay, so going with the misnomer of TMJ issues, but is this typically caused from genetics? Is it just a condition that develops? Is it because people may be doing grinding their teeth when they sleep? Like, what's the main cause that leads to these issues, these TMJ issues?
It's all of that, actually. The growth is a big part of it. Nasal breathing, whether you have had allergy issues and you're a mouth breather, because when you look at all the musculatures on our face, majority of the muscles are on the outer side. And when you look at how you open and close, the force is usually greater from outside in. So if your tongue is not in a proper posture, we like our tongue to be on the roof of the mouth to counterbalance the outward to inward pressure, outside to inward pressure of muscle function. Then we have to have our lips sealed, generally speaking, at rest. Our tongue needs to be on the roof of our mouth to counterbalance that compression force. And we also have to breathe through our nose to inflate sinuses. So if any of those things are compromised while you're developing or growing, then we're going to have shrunken or narrow arches, which causes problem. As adults, sleep apnea is a huge issue. I think majority of the dentists are aware of this issue. So if you're having sleep apnea, a lot of heaviness on our neck where airways closed, then we compensate by opening our mouth to intake the air. So constant mouth breathing also narrows the face.
Mm.
So
Okay,
that contributes to the problem.
got it. Now, when it comes, we talked a little bit about the misconceptions or misnomers with the name, but what are some of the other common myths or misconceptions you hear out there, or even from your patients?
Regarding jaw pain?
Either jaw pain or the treatments that you provide, or just kind of
Oh, yes, yes.
TMJ. Mhm.
So, unfortunately, TMJ treatment is not something that is generally taught in dental school
Mm.
and is very minimally covered. So, when dentists come out of the dental school, uh, only thing, or not only thing, majority of dentists, the way we treat TMJ treatment is just to make your mouthpiece, right?
Mhm.
And fortunately, that works for vast majority of patients because we are creating a space, and usually the lower jaw could move a bit more freely because it's not locked in by upper jaw morphology or cusps. So that improves. But if patients are wearing these guards all the time, it's essentially a spacer, right? It adds dimension, and you take it out once in a while, you put it in whenever you have pain. So when you're constantly using that, what you're essentially doing is you're compressing or intruding the teeth in. So dimension is actually the skeletal structure is actually getting shorter. So it solves problem temporarily, but if it's used long term, then it creates another problem. So that is something that is really is prevalent, I would say, because majority of the TMD treatments are done with removable appliances. So I don't personally like that. I know I'll probably make a lot of dentists mad by saying this, but for me, that is very, very temporary treatment. The other thing that a lot of dentists are doing is injecting Botox. I used to do that as well, but as I dive into this topic more and more, I stopped doing it because our bone structure needs stimulus to maintain bone health. Not only that, we have to have proper balanced hormone, minerals, and vitamins, and all these things. But if you are reducing uh, stress that muscles put on our bone, if we do it chronically or continuously, we're actually allowing the skeletal structure to receive less stress and shrink or promote shrinkage. It's okay if you're having acute pain to relieve what we call trigger points, where the muscles really tight on particular spot. We can release that with Botox. But personally, I would rather see it resolve permanently instead of just continually injecting Botox. So I would say those two are the most common things that I see as far as patients seeking TMJ treatment. They'll say, I need a new guard, or, it's been working for a while, but it's not working. I think I need a new one. Or people call and say, hey, I need some Botox injections for uh, jaw pain. So
Mm. Okay. And let's say someone's looking for a cosmetic dentist but doesn't know who to go to. What would be the most important advice you can give to this person as they're doing their search so that they can find a cosmetic dentist who is knowledgeable, has the experience, and can help them get the end result they're looking for?
I would say, cosmetic dentistry is not recognized specialty of American Dental Association. So essentially, anybody could say they do cosmetic dentistry, but cosmetic dentistry is a really challenging and difficult field, difficult specialized segment of dentistry.
Mhm.
So first, you have to, the best thing to do is ask around. And American Academy of Cosmetic Dentistry has very rigorous accreditation process. You have to take exams, you have to submit your clinical cases, and you have to be interviewed, and all these things. So I would say start looking at who is accredited in that website. That's usually a good place to go. But also, I would ask if the patient can talk to some of the patients they have worked on, and if they're really happy with what they do and confident, then they'll be more than happy to give you past patients to talk to, and also look at before and after images uh, on the website. Whether nowadays when you look at the website, it's a horrible thing, but I had my images stolen from my website by another dentist. So it just really, really not a really good thing to see that happen. But you want to make sure the work they do is their own work as well. Yeah.
Got it. Okay. Now, Dr. Chow, where do you think the future of dentistry is going, particularly cosmetic dentistry?
Uh, I I love your question. I think cosmetic dentistry will have to evolve into not only addressing the teeth aesthetics, but overall aesthetics, the facial aesthetics, teeth aesthetic, at the same time, addressing functional issues so that when it's done, it is a lifetime restoration, not whatever the Google says or whatever the internet says, you have to get it done like after 10, 15 years. No, once you do it, it should be the lifetime restoration. And also, minimally uh, grinding the teeth. Because in the old-fashioned way, we crowned everything. We literally destroyed the teeth for the sake of putting porcelains or the materials. And I think general public is kind of understanding this better and better. The less you do to your natural teeth, the better you're off for obvious reasons. So you want to try to keep healthy home care, diet, and hygiene. But when you require restoratives, then I think the best way is to, it can't be avoided sometimes, but minimally grind your natural teeth. Yeah.
Got it. Great advice
That
there.
I think that's the future. Yeah.
Okay, got it. Now, Dr. Cha, I do have one last question for you, but before I ask it, I do want to point people to your website at jchacosmeticdental.com. Now, last question for you, Dr. Cha. What does beauty mean to you?
Beauty really is nothing outside. I think the core of the beauty is health and balance. What I mean by balance is your soul, and you have to have something greater than what this earth or worldly things say is beautiful. I think we all need some spiritual compass or guide that directs all of us to understand what is right and what is wrong. So that's my definition of beauty: is first balanced, function, health, and then spiritual direction.
Okay, well, there you have it. Dr. Cha sharing his expertise. So, Dr. Cha, where can people contact you in your practice?
My practice is in Edmond, Oklahoma. It's a suburb of Oklahoma City, but I have many patients coming in from surrounding states. I have one coming in from Boston. So just check my website, and the contact information is there. They could email us or call us, or however they find us to get us. We'd be happy to talk to you guys.
Awesome. All right. Well, Dr. Cha, this is great. Thank you for coming on. Thank you for sharing your knowledge, and thanks for sharing your message.
Thank you so much.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.